Correspondent Nicole Hill joins us from London. Good to see you, Nicola. Now, talk to us about what exactly happens in an intensive care unit.
Well, as you can imagine, it's an extremely busy place. It's very noisy because of all the machines that are there, but it's very calm. And it's staffed with people who are extremely skilled. These are the doctors, the nurses, the pharmacists, the physiotherapists. And together they're giving effectively one-to-one care to the patients who are in there, whether they're ventilated, like you can see in the pictures, or having oxygen, like our Prime Minister. And they're monitoring them. They're monitoring them second by second, the blood pressure, the oxygen levels. If the oxygen's dropping, their lungs are stiff, so they need this extra oxygen to help them breathe, which again is what our Prime Minister is having here in the UK. They're also looking at their kidney function, their heart. Every single part of the body is being monitored to make sure that they're comfortable and that their own body can fight the virus, because at the moment, although it's fascinating to hear about the plasma treatment we've just heard then, at the moment there's no treatment for patients.
And what happens when patients leave ICU, and how quickly can they recover?
Well, patients are normally in ICU for like 7 days, 2 weeks. They might then go back to a ward, or they might be allowed home. Now, I was speaking to a lady this morning, Riyad Khani. She had COVID-19. She was in an intensive care bed for a week. She had an underlying health condition which made her more susceptible to get this, even though she's only 35. And she's now back at home. And what was so interesting was the fact that she's been home since Sunday. She spoke to me because she really wants to make everybody aware that it's such a serious disease. She said to me, with every breath that she can take, she wants to spread the message to be careful and stay at home. But she said to me, after talking to me this morning, she then won't be able to speak for several hours because it will have exhausted her and it will have used up a lot of her oxygen levels. So she's on bed rest. She reckons it's going to take her several months to recover. Now, as I said, she does have an underlying health condition, which makes her weaker than other people, but she's 35 and she's had excellent health care. And she also told me that at night, her oxygen levels drop and sometimes she still is waking up gasping for breath. It's terrifying, but she's so pleased that she's out. There was at one point, she said, there were never more than, doctors were never more than a metre away from her bed the whole time she was on this intensive care bed. But at one point she noticed that there were an awful lot of doctors surrounding her and she was needing 15 litres of oxygen. And that's when she was sitting there, lying there thinking, I need to write letters to my family. But she has recovered. She's home, she's doing well, and as I said, she wants to use her limited amount of breath to spread that message to stay at home and to social distance.
Great to hear that news about your friend. Nicola, thank you so much. Really appreciate your reporting.